All right, let's jump right in, shall we? Ready for a deep dive into the world of sepsis and septic shock?
Oh, always up for a challenge, especially when it comes to a topic as crucial as this.
You're right. This isn't just some random medical jargon. We're talking about a global health crisis here.
48.9 million cases globally,
Yeah.
11 million deaths annually.
Whoa. So imagine you're prepping for, like, a huge medical conference.
Right.
Or maybe you're just, super curious about this whole sepsis thing. We're going to break down this super dense medical review.
Dense is putting it mildly.
I know, right? From the New England Journal of Medicine, no less. It's packed with, like, all the crucial info and some surprising facts, so buckle up.
Yeah, it's a wild ride through the immune system for sure.
So before we get into all the nitty-gritty details, let's make sure we're all on the same page here, right?
Absolutely.
How has the medical world's understanding of sepsis, like, evolved over time?
Well, the definition itself has actually shifted, over the years.
Oh, really?
But
Yeah, interesting.
it used to be thought of as just this, like, out of control inflammatory response to infection.
Okay.
But now it's understood as life-threatening organ dysfunction caused by a dysregulated immune response to infection.
So it's not just inflammation going crazy, it's the whole immune system
Yeah,
kind of going haywire.
exactly. It's more nuanced than just, inflammation running
Uh,
rampant.
It's like the whole system getting its signals crossed.
Yeah, it's like instead of a well-coordinated defense, you have this chaotic immune response,
Ooh, that's a good way to put it.
leading to organ dysfunction.
And speaking of chaos, did you know the word sepsis actually comes from the Greek word sepo?
I didn't actually.
It means I rot.
Wow. It's pretty intense, right?
Yeah, it's a bit grim, isn't it?
It is, and it's especially devastating in low and middle income countries.
Yeah, the burden is huge.
Sub-Saharan Africa in particular.
They bear a disproportionate burden of sepsis cases and deaths.
Why is that?
Access to healthcare is definitely part of it, but it's more complex than that. Right. The strain of diverse pathogens in these regions plays a huge role.
Oh, okay.
You're talking about malaria, typhoid, dengue, HIV, and TB.
So the types of infections you're likely to encounter really do change depending on where you live.
Absolutely. Different parts of the world, different infection landscapes.
So where in the body do these infections typically take hold?
Well, the lungs are a major battleground for sure.
Oh,
They
interesting.
account for a majority of cases. Then you have the abdomen,
Okay.
urinary tract, bloodstream, and skin.
So it can really hit you anywhere, huh?
It can. But it's crucial to remember that any infection, if it's left unchecked and the immune system goes off the rails, has the potential to lead to sepsis.
It's not just about the location, but about the body's response to the infection.
Absolutely. It's all about that immune dysregulation.
And what about the culprits behind these infections? Is it always bacteria?
Bacteria are the usual suspects, for
Yeah.
sure.
Yeah,
But we're seeing a rise in fungal infections, especially candida.
And of course, viruses can also trigger sepsis, especially during pandemics.
Okay, so a variety of villains can set this whole cascade in motion. Now, this is where it gets interesting. Who's most at risk for sepsis?
Yeah, that's a great question. It's not as straightforward as you might think.
I know.
While age is a big factor,
Right.
it's not a simple, like, linear relationship.
Oh, okay.
The very young and the very old are actually the most susceptible.
Wait, really? So it's not just about weakening immunity as we age?
It's more nuanced than that. Infants have immature immune systems.
So their systems are still learning, right?
They're still learning to fight off infections effectively.
Right.
Then, as we age, our immune systems naturally start to decline,
So we become more vulnerable again.
making us more vulnerable again. It's like a U-shaped curve,
Ooh, I like that.
with the highest risk at either end of the lifespan.
That's a really helpful way to visualize it.
Yeah, it helps to see it that way.
So it's not just about age itself, but how well equipped our immune system is at any given time.
Exactly. And then, of course, we have pre-existing health conditions.
Right.
Things like cancer, kidney disease requiring dialysis, or severe immunodeficiency.
Oh, yeah, that makes sense.
All of these increase the risk of developing sepsis. It all comes down to the overall resilience of your immune system.
It sounds like a perfect storm of factors can make someone vulnerable. So let's talk about what's actually happening inside the body when sepsis takes hold.
All right, let's get into the nitty-gritty.
Our source describes it as a biological battlefield.
It's a pretty accurate description, I'd say.
Can you break that down for us?
Sure. What happens in sepsis isn't just excessive inflammation.
Right.
It's this complex interplay between too much inflammation and immunosuppression.
Wait, hold on. How can the body be experiencing both at the same time?
It's a paradox, right?
Yeah.
It's like your body is slamming on the gas and the brakes simultaneously.
Ooh, okay.
Picture this. Your immune system sends out neutrophils, those white blood cells that are like the first responders.
Okay, I'm following.
They're there to fight the infection, but in sepsis, they show up in huge numbers, but they're not functioning properly.
So they're like soldiers forgetting their weapons. They're there, but they can't fight effectively.
Exactly. They're overwhelmed and dysfunctional.
Wow.
And it's not just the neutrophils.
Oh, no.
Monocytes, another type of white blood cell, they become less effective at producing cytokines,
Cytokines.
those crucial signaling molecules that help coordinate the immune response.
Right.
They become sort of tolerant to the constant barrage of signals from the infection.
That makes sense. Like, if you're constantly bombarded with alarms, eventually you might start tuning them out.
Exactly. And then there are the lymphocytes.
Lymphocyte.
The B cells and T cells are like the special forces of the immune system, right?
Right.
In sepsis, we often see a decrease in their numbers. It's like losing troops, both on the battlefield and back at day camp.
So it's a multifaceted immune meltdown. Different parts of the system failing in different ways.
That's a good way to put it. Multifaceted, for sure.
Our source also mentions this complex metabolic shift that happens during sepsis. Can you tell me more about that?
Yeah, that's a really interesting area of research. Normally, our cells produce energy through a process called oxidative phosphorylation.
Okay, big words.
But when we get infected, the body shifts to a different process. It's called aerobic glycolysis
Aerobic glycolysis.
to fuel the immune response. But in sepsis, this shift becomes dysregulated, leading to a sort of metabolic failure in immune cells.
So it's like the body is running a marathon, but forgets to pack energy gels.
Exactly.
The immune cells get exhausted and can't fight effectively.
That's a great analogy.
Thanks.
And this metabolic dysfunction can have cascading effects throughout the entire body,
Oh, wow.
contributing to the immunosuppression we see in sepsis.
It really highlights how interconnected our bodies are.
It does, doesn't it?
The immune system, the metabolism, everything's linked.
It's all one big, complex system.
And I imagine the circulatory system, with all its blood vessels, also plays a role in this whole sepsis saga.
Oh, absolutely. The blood vessels are key players.
What's happening there?
Well, they become profoundly dysregulated in sepsis. Think of the endothelium, the lining of blood vessels, like the gatekeeper,
The gatekeeper.
controlling the flow of fluids, nutrients, and immune cells. But in sepsis, the gatekeeper loses control.
So it's like the blood vessels spring leaks.
Exactly. The permeability of the endothelium increases, allowing fluids to leak out of the bloodstream and into the surrounding tissues.
Okay.
This causes swelling and can contribute to hypotension.
Hypotension.
Low blood pressure, which is a major red flag in sepsis.
Low blood pressure sounds dangerous. What makes it so concerning?
Well, hypotension is a serious problem because it starves the organs of oxygen and nutrients,
Oh, right.
ultimately leading to organ dysfunction.
Yeah.
And then the blood vessels also become more prone to clotting, creating a traffic jam in the circulatory system.
Wow, that paints a pretty scary picture.
Yeah, it's a cascade of events that can quickly spiral out of control.
With all these things going haywire, how do doctors even begin to diagnose sepsis?
That's the real challenge. Sepsis is a master of disguise.
Ooh, I like that.
Its symptoms can be very varied and often mimic other conditions, especially in the early stages.
So no easy shortcuts for diagnosis.
Unfortunately not.
What are some of the signs that doctors look out for?
Common signs include fever,
Okay.
altered mental status, like confusion or disorientation,
Mm-hmm.
low blood pressure, and rapid breathing.
So those are all pretty common though, right?
They are, and that's the catch.
Ah, I see.
These symptoms are also present in a whole host of other illnesses.
So it's all about connecting the dots,
Exactly.
considering the patient's history and relying on those clinical instincts.
Doctors need a high index of suspicion.
Yeah, they have to really be thinking about it.
They have to actively consider sepsis as a possibility, even if the initial presentation seems vague.
That makes sense.
Then it's a combination of careful clinical evaluation, lab tests, and sometimes imaging studies to confirm the diagnosis.
It sounds like a real race against time.
It is. Time is of the essence.
Once sepsis is diagnosed, what's the immediate game plan?
Speed is key. The management of sepsis focuses on two main goals:
Okay, 2 goals.
stabilizing the patient and supporting any organs that are starting to fail.
Okay, so it's about damage control.
Exactly. Damage control and getting the patient back on track.
How do doctors approach that?
It's a multi-pronged attack. The first priority is infection control,
Infection control.
hitting that underlying cause head on.
So taking out the root of the problem.
Exactly. Eliminate the source of the infection.
Does that always mean antibiotics?
Antibiotics are often the first line of defense, especially if the culprit is bacteria.
Yeah.
But sometimes we need to go further
Further.
and physically remove the source of the infection.
So in those cases, it's not just about drugs, it's about surgical intervention.
Precisely. Sometimes surgery is necessary to control the infection.
What kind of procedures are we talking about?
It could involve something like an appendectomy to remove an infected appendix or draining an abscess.
Okay.
Sometimes, even removing infected medical devices is necessary. It all depends on the specific situation.
So infection control involves a combination of medications and sometimes surgery.
It's a multi-pronged approach, for sure.
What about stabilizing the patient? What does that entail?
One of the critical steps is restoring adequate blood flow
Okay.
and perfusion to the organs, making sure they're getting the oxygen and nutrients they need.
That makes sense. So this is where we get into fluids and medications that raise blood pressure, right?
Yes, intravenous fluids are typically the first step to replenish blood volume and boost blood pressure.
Fluids.
But there's an ongoing debate about how much fluid is optimal.
Really?
It's not as simple as more is always better.
Hold on. How can too much fluid be a bad thing?
It's counterintuitive, I know.
Yeah. I would think you'd want to pump them full of fluids to get the blood pressure up.
But there's a U-shaped relationship between fluid volume and mortality in sepsis.
A U-shaped relationship,
Too little is bad,
obviously.
but too much fluid can actually worsen outcomes.
Oh, wow. That's interesting.
It's about finding that sweet spot. Not too much, not too little.
So it's like Goldilocks and the Three Bears.
Exactly. Just the right amount.
Okay, I'll keep that in mind. And if fluids alone aren't enough to stabilize blood pressure?
Then doctors turn to medications called vasopressors.
Vasopressors. I've heard of those.
They essentially squeeze the blood vessels to raise blood pressure.
Right.
Norepinephrine is often the go-to vasopressor for sepsis, and sometimes doctors add vasopressin if needed.
Vasopressin, okay.
The challenge is to support blood pressure without causing harm from prolonged vasopressor use.
Right, it sounds like a delicate balancing act.
Mhm.
Now, what about steroids? I know they're sometimes used in severe cases of sepsis.
You're talking about glucocorticoids.
Glucocorticoids, right.
Specifically, stress-dose glucocorticoids. There's been a lot of back and forth about their use in sepsis.
Really?
Some studies show a benefit, others don't.
So is there a clear answer on whether to use them or not?
Not really. Current guidelines suggest considering them for patients with persistent septic shock,
Persistent septic shock.
but the decision should be made on a case-by-case basis, weighing the potential benefits against the risks for each individual.
It sounds like there are no easy answers in sepsis management.
You got it.
Every decision requires careful consideration and a personalized approach.
Absolutely.
Uh.
Speaking of personalized approaches, let's talk about what happens after someone survives the initial sepsis crisis.
Okay.
It's something that's often overlooked, but recovery from sepsis can be a long and difficult road.
That makes sense. It's not just about getting through the acute phase. It's about dealing with the long-term consequences.
Exactly.
What kind of challenges do sepsis survivors face?
Well, they're at increased risk for a whole range of complications down the line. One of the most concerning is cognitive impairment,
Cognitive impairment.
sometimes referred to as sepsis brain.
Sepsis brain. What does that involve?
Many survivors experience problems with memory, concentration, and thinking skills. They may have trouble focusing, remembering things, or making decisions.
Oh, that's scary. Are there other long-term effects?
Yes, functional limitations are also common.
Functional limitations.
Survivors might struggle with everyday activities that we often take for granted, like walking, bathing, or dressing themselves.
Oh, wow.
And they're at a higher risk of developing new or worsening chronic health conditions,
Like what?
like heart disease or diabetes.
Wow. So surviving sepsis is just the first battle.
It is.
Then comes the long-term fight to regain your health and quality of life.
It's a long road to recovery for many survivors.
It really makes you realize just how serious sepsis is.
It is. It's a life-altering condition for many.
And it definitely highlights the need for better ways to prevent, diagnose, and treat it.
We've come a long way in our understanding, but there's still so much more to learn.
What does the future hold for sepsis research?
Well, there are some really promising areas of research on the horizon.
Okay, good. I like to hear that.
One exciting development is the focus on creating better diagnostic tools.
Ooh, diagnostics. That's huge.
Imagine being able to pinpoint the exact pathogen causing
Yeah,
sepsis
like right away.
within minutes,
Wow.
or even predicting how an individual will respond to a specific treatment based on their unique profile.
That would be amazing. It would take so much of the guesswork out of it.
It would revolutionize how we approach sepsis.
What other research avenues are scientists exploring?
Another focus is on defining subtypes of sepsis.
Subtypes.
Right now, we tend to lump all cases together,
Right.
but there's growing evidence that different people experience sepsis in vastly different ways.
Oh, interesting.
Their immune and metabolic responses can vary widely.
So like personalized sepsis almost.
In a way, yes. By subtyping sepsis, we could potentially develop more personalized and effective treatments.
Instead of a one-size-fits-all approach.
Exactly. Tailoring treatments to the specific way sepsis is manifesting in each individual.
That's incredible. And are there any new treatments on the horizon?
There's a lot of energy being poured into developing targeted therapies that address the root cause of the problem, the immune dysregulation.
So not just putting out the fire, but preventing the fire from starting in the first place.
That's the ultimate goal. It's a complex challenge, but ongoing research gives us a lot of hope for better diagnosis, treatment, and ultimately better outcomes for sepsis patients.
This has been a really eye-opening deep dive into the world of sepsis.
It is a fascinating topic.
I feel like I've learned so much about a condition that I honestly didn't know much about before.
It's definitely a condition that deserves more attention.
Yeah, absolutely. It's like a domino effect, right?
It is, yeah.
One thing goes wrong, and it triggers a cascade of events throughout the entire system.
A cascade of events.
It makes you realize how crucial it is to take care of our health.
Absolutely. And to listen to our bodies.
And to listen to our bodies.
And seek medical attention if something seems off.
Early detection and intervention can make all the difference when it comes to sepsis.
Couldn't agree more.
Well, this deep dive has been incredibly informative and definitely thought-provoking. Thank you so much for guiding us through this complex topic and sharing your expertise.
My pleasure. It's always rewarding to shed light on such a critical issue and hopefully spark some curiosity in our listeners.
And to all our listeners out there, thanks for joining us on this journey.
We appreciate you tuning in.
We hope you learned something new and maybe even had a few aha moments along the way.
Knowledge is power, after all.
Couldn't have said it better myself. Until next time, keep diving deep, stay curious, and never stop learning.
See you next time.